What is Zalplan? Zalplan is a sedative that is used to treat insomnia. Zalplan causes relaxation to help you fall asleep and stay asleep. Zalplan may also be used for purposes not listed in this medication guide. Warnings: some people using this medicine have engaged in activity while not fully awake and later had no memory of it. If this happens to you, stop taking Zalplan and call your doctor right away. Serious injury or death could occur if you walk or drive while you are not fully awake. Before taking this medicine, you should not use Zalplan if you are allergic to it, or if you have ever taken sleep medicine and engaged in activity you later don't remember. Zalplan is not approved for use by anyone younger than 18 years old. Tell your doctor if you have ever had liver or kidney disease, a breathing disorder, depression, mental illness, or suicidal thoughts, or drug or alcohol addiction. You should not take Zalplan if you are pregnant. You should not breastfeed while using Zalplan. The sedative effects of Zalplan may be stronger in older adults. Accidental falls are common in elderly patients who take sedatives. Use caution to avoid falling or accidental injury while you are taking Zalplan. How should I take Zalplan? Follow all directions on your prescription label and read all medication guides or instruction sheets. Use the medicine exactly as directed. Zalplan may be habit-forming. Misuse can cause addiction, overdose, or death. Keep the medication in a place where others cannot get to it. Selling or giving away Zalplan is against the law. Zalplan will make you fall asleep. Never take this medication during your normal waking hours, unless you have several hours to dedicate to sleeping. Zalplan is for short-term use only. Do not take Zalplan for longer than 5 weeks without your doctor's advice. Call your doctor if your symptoms do not improve after 7 to 10 days of treatment, or if they get worse. Do not stop using Zalplan suddenly after taking it over several days in a row, or you could have unpleasant withdrawal symptoms. Ask your doctor how to safely stop using this medicine. Store at room temperature away from moisture, heat, and light. Keep track of your medicine. You should be aware if anyone is using it improperly or without a prescription. Insomnia symptoms may also return after you stop taking Zalplan, and may be even worse than before. Tell your doctor if you still have worsened insomnia after the first few nights without taking Zalplan. What happens if I miss a dose? Since Zalplan is taken only at bedtime, you will not be on a frequent dosing schedule. Never take this medication if you do not have several hours to sleep before being active again. Do not take 2 doses at one time. What happens if I overdose? Seek emergency medical attention or call the poison helpline at 1-800-222-1222. An overdose of Zalplan can be fatal, especially when it is taken together with other medications that can cause drowsiness. Overdose symptoms may include severe drowsiness, confusion, loss of coordination, severe muscle weakness, weak or shallow breathing, fainting. What should I avoid while taking Zalplan? Avoid taking Zalplan during travel, such as to sleep on an airplane. You may be awakened before the effects of the medication have worn off. Amnesia, forgetfulness, is more common if you do not get the equivalent of a full night's sleep after taking Zalplan. Do not drink alcohol. Dangerous side effects or death could occur. Avoid taking Zalplan with food or right after eating a high-fat or heavy meal. This will make it harder for your body to absorb the medicine. Zalplan can cause side effects that may impair your thinking or reactions. You may still feel sleepy the morning after taking the medication. Until you know how Zalplan will affect you during waking hours, be careful if you drive, operate machinery, pilot an airplane, or do anything that requires you to be awake and alert. Zalplan side effects. Zalplan may cause a severe allergic reaction. Get emergency medical help if you have signs of an allergic reaction, hives, difficult breathing, nausea and vomiting, swelling of your face, lips, tongue, or throat. Some people using this medicine have engaged in activity while not fully awake and later had no memory of it. This may include walking, driving, or making phone calls. If this happens to you, stop taking Zalplan and call your doctor right away. Serious injury or death could occur if you walk or drive while you are not fully awake. Zalplan may cause serious side effects. Call your doctor at once if you have anxiety, depression, aggression, agitation, memory problems, unusual thoughts or behavior, thoughts of hurting yourself, or confusion, hallucinations, hearing or seeing things. Common side effects of Zalplan may include daytime drowsiness, dizziness, hangover feeling lightheaded, problems with coordination, or numbness, tingling, or prickly feeling on your skin.